What was supposed to be an informative hearing turned heated Thursday as Representative Kristi Noem expressed disgust when VA officials didn't come prepared to answer questions.
I did not think the VA came prepared at all. I don't know if it was on purpose, if it was intentional, but frankly I was offended by the fact and the number of times that they told us they didn't know and they would have to get back to us.
The Hot Springs VA is plagued by data discrepancies and dismantling of services provided at the hospital. Noem says Secretary Shinseki promised this would not happen.
Numbers did not match up. They couldn't justify how they tried to reconcile the numbers that the committee was coming up with.
Pointing out there are discrepancies specifically when it comes to Native Americans using the Hot Springs facility. Brian Brewer, president of the Oglala Sioux tribe, spoke, saying he believes if the Hot Springs VA closes, Native Americans will be faced with severe hardship.
President Brewer was very clear today in his testimony before the committee that he felt veterans would die if this facility closed.
And with the recent VA scandal and Secretary Shinseki resigning, many believe it inappropriate to close the VA at this time.
We are now fighting with them over an issue in regards to deaths that have occurred because of delayed care.
Leading to Amanda Campbell, a member of the Save the VA committee, calling for Stephen DeStasio, the VA Black Hills director, to resign.
We are calling for the immediate removal of the Black Hills VA Healthcare System director.
Something that Noem says is justified.
I think that for her to feel that way and to demand that kind of consequence, I think certainly was justified.
Adding changes in leadership can fix the problem. DeStasio said the wait time for veterans to be seen is a 3-day average, but every veteran in the audience says it's weeks before they're seen. The VA's internal audit showed the Black Hills healthcare system to be the worst for delivering care to our veterans.
They have done nothing to show us that they're holding people within the VA accountable to those kind of audit reports, and for me, I was extremely disappointed.
Noem repeatedly requested data points on numbers, the number of veterans served, and the VA's proposal and cost analysis from DeStasio, but no answers were given.
This doesn't just affect Hot Springs, it affects Nebraska, it affects Wyoming, it affects Pine Ridge, it affects Rosebud, it affects everywhere.
Some veterans drive more than 100 miles and still don't find the services they need. Ronald Sprague, a Vietnam veteran, drives at least once a week to Hot Springs from Chadron, Nebraska.
I think it needs to be left open. I think that they're trying to take away services to close it.
And when I asked seasoned veteran Fred Canoose what he would do if the VA hospital was taken away from him, it was silence that followed.
Quite angry.
And all veterans in the audience echoed Thursday was how much the Hot Springs VA means to them.
We'll be lost without it, I'll tell you. It's a godsend.
Stephanie Kayser, News Center 1.